Okay, good afternoon, everyone. I'm Maricela Garcia. I'm the Race Equity Director for Arkansas Advocates for Children and Families, and we're here today to discuss our brand new report on the status of SNAP in Arkansas. Um, my contact information is here on the screen. If you have any questions and you want to follow up, but as Rebecca said, we will send out the report with the recording and any further information. Um, you know, I think it's really exciting for me that there's so many people here today interested in promoting equitable policies for SNAP in Arkansas, because our report on state SNAP policies and how they're failing Arkansas's kids and families really focuses on policy recommendations that are equitable to help make sure that all of our families and children in Arkansas can thrive. The report's available on our website, which is aradvocates.org. And you can download it. You can share it with friends or family members who might be interested, or others who are, you can share it on social media or colleagues. So today we're going to review the history of SNAP and how state policy decisions allow a person's experience with SNAP to really differ by where they live, which state, and sometimes even which county. It's very different in Arkansas than it is in other states. We'll look at how we compare, but we'll also look at equitable policy solutions that we know will help Arkansas ensures it addresses the current crisis of food insecurity in our state. Um, we know this is the perfect time to discuss these issues as the legislature is currently in session, and we can take positive steps to help ensure that we eliminate hunger in Arkansas. We welcome any questions that you have. If you put them in the chat box, Rebecca will be able to pause me and we can talk. I really want us to have a full discussion if there are questions about what we're talking about. Obviously, you all haven't had time yet to read the report, but we appreciate you all being here. Definitely, we want to thank Maison, a Jewish response to hunger, for supporting the research and production of this report. We're grateful for them, but we do want to let you know that the findings and opinions and policy recommendations in the report don't necessarily reflect that of the foundation. They're the opinions and policy recommendations of Arkansas advocates, our staff, and our board, but we appreciate their support in making this work happen. I personally want to thank all of the people who have helped make sure this report came to be. You know, Brooke Edwards, our communication director, for her constant patience and support and questions that I had during the time we were putting this all together and making this happen. Rebecca Zimmerman, who is always here to make sure that we get engaged with the community and ensure that I get on Zoom and it works properly. Pete Guess, our economic policy director, who spent a lot of time helping me understand how this data from the federal level and the state level works together and how we can make it easy for people to look at and understand what's happening in Arkansas. I also want to thank Kisa Smith, our executive director, um, Laura Kellums, our Northwest Arkansas director, and Kristen Harper, our policy director, who have been overseeing the production of the report throughout the time. It's really important here at Advocates that we work on these things together because everybody has a piece. And I think that's part of why it's so important to us to make sure that data is available for people. And that's what this report is doing. It's giving you the state of SNAP in Arkansas. The reason we're here right now is because Arkansas currently has the highest food insecurity rate in the nation during a time when costs are rising for families. And instead of making access to SNAP, which is the #1 hunger program in the United States, we are making it harder. We make it unnecessarily hard for families to be hungry in Arkansas, and it doesn't have to be that way. So that's why we're doing this report, to let you know about what policy opportunities exist in Arkansas and how we can make this better. And again, we don't have to accept this. It does not have to be this way. Our policy choices that we've made over the years have actually made it more difficult to enroll in SNAP, the Supplemental Nutrition Assistance Program. And we just make it harder in general to become eligible and to stay eligible than it would be in most other states. The impact of the COVID-19 pandemic really exacerbated issues that already existed long before COVID hit here. And we continue, even after the pandemic, to make policy choices that just make it harder for people to have access to these necessary benefits. So the root causes and intersections of why hunger has become so hard to solve in Arkansas really goes back for decades. We have continually made choices in terms of policy that just does not support families who are hungry, who are living in poverty. And that's why data was released this year, which showed that food insecurity we are the highest this year, 18.9%, and or sorry, for 2023. So not this year, but the most recent year available. And the national rate is 13.5%. So we are well over 5% higher. USDA defines food insecurity as an economic and social condition of limited and uncertain access to adequate food. But what does that mean? What it really means is that a child or a person who is food insecure does not have enough food for every meal for every day of the week. And because our rate of hunger also went up for the same period for children, we went from 19% in 2021 to 25% of all children in Arkansas being hungry. Hunger is a much larger term. In terms of food insecurity is at least one meal a week, and hunger means that they lack sufficient food overall. So it's an ongoing condition. And that means in 2023, nearly 570,000 Arkansans, more than 500,000, and of those, 168,000 were children. They lacked sufficient food. I just think in general, we should all be able to agree that these numbers are unacceptable. And we need to look at the impacts of what this means. Because we've failed to address this over the decades, and instead made it harder and harder to access programs such as SNAP, WIC, Women, Infants, and Children, or even school meals. Food insecurity and hunger continues to rise among children and families, including working families. And in addition, we need to think about what does that mean? There are significant and cumulative long-lasting consequences on children, families, and communities because children can have the impact of being hungry begins before birth, and it can last through adulthood. And it can include long-term conditions that result from the lack of nutrition, including nutritional deficiencies, iron deficiency anemia, rickets, cancer, stroke, type 2 diabetes, coronary heart disease, osteoporosis, as well as other issues. And one thing that's really interesting in the data is that being hungry as a child is more likely to cause weight gain as an adult, and that person is more likely to be overweight. We don't know all of the connections there, but certainly it seems like there is an issue between the body not having enough nutrients and trying to make sure that it's saving what it has. So as we fail year after year to address these statistics among our kids, what we're doing is building a new generation of adults who are growing up with these long-term health conditions. It's not necessary. We know the answers and we can address them. Excuse me for 1 minute. I'm just looking at. Are you not seeing the slides, Rebecca?
I see a slide that says, why has hunger become so hard to solve?
Correct. So people are saying they're not seeing the slides.
I think
Ooh.
they thought some of the data points that you were referencing were in a slide.
Oh, they are not. They are on the next page. We're gonna get to the charts right now. So is everybody seeing why has hunger become so hard to solve? Okay, great. Don't scare me like that. That's a big I don't know how to fix it. All right. So we should be seeing a chart now that looks at the past 10 years of Arkansas's poverty, food insecurity, and SNAP enrollment data. So the red line is food insecurity and very low food insecurity. We again exceed most other states in that level. Um, the yellow is individuals who live in poverty. Poverty is 100% of the federal guidelines, which are identified by the federal government every year. Um, they put out these numbers, and for anybody who is a fan of West Wing, you know that those numbers were created in the 1960s by someone who was really looking at food as the number one cost, and those costs have really changed. And so the poverty guidelines really aren't an accurate representation. The other thing to remember when you look at this chart is the poverty is staggering, but it's also SNAP enrollment is higher than the level of poverty. So SNAP enrollment is 130%. And we'll get into that a little bit more. But what you can see with the blue bars is that SNAP enrollment has steadily gone down, even though food insecurity and very low security are increasing significantly. For the period of time between 2019 and 2020, there is a small amount of time that it goes down there, or sorry, between 2018 and 2020. And then when the pandemic starts, it kicks back up at a very high rate, much higher than it was going down. And when you look at that and you see that poverty is increasing, food insecurity is increasing, but SNAP enrollment is decreasing by roughly more than 50,000 people a year, with the exception of 2019 to 2020. So the way that the year works for SNAP is that it runs from July 1st through June 30th of the following year. So the year for 2020 would have ended June 30th, 2020, and that means it's the start of the pandemic. And then you see there's an increase in 2021. That's what we would call the height of the pandemic, that first summer surge through the next summer. And then you see that poverty gets a little bit higher. It overall goes a little bit down, but what's happening is that we maintain that roughly same high rate of poverty in the state, and food insecurity and very low food insecurity is going up sharply, and yet SNAP enrollment is going down.
That actually leads kind of into our next question, timeline wise.
Sure.
Someone asked, they know that there's always a lag in data coming out, but
Uh,
when could we expect the 2024 data?
So 2024 data of enrollment will probably not be until the middle of this year, maybe not until September from DHS. I do want to thank DHS as well. If I didn't say that already, they helped us significantly with providing a lot of the data that you'll see in the report. Um, on the number of people and information in general. But so it is generally, if we're talking about information from the state, it's a year. If we're talking about information from the federal government, it tends to be a couple years out. So we were lucky that 2023 converged all at the same time between September and December for the American Community Survey, the small area. It's another version of census surveys, but the small area income poverty evaluation. And then also DHS's 2023 data came out. So we were very lucky with this report to be able to have data that is all from the same time period to be able to compare it overall, as well as I'm sorry, FNS is the Food and Nutrition Service of the Department of Agriculture. So they also are the ones who put out brand new food insecurity and very low food insecurity data this year. So it's very rare that they run on the same timeline, but we did get all of it in 2024, which is very rare. So some data, we can only get it from the federal government, even though it's about the state. If the state doesn't report on things, it's not available to the public. So that's just how it works. So it can take some time when we're looking at what are the trends and the demographics and things like that.
We
Any
have
other?
a, yes, sorry to interrupt you. Yes,
No problem.
we have another question. Do you think the data on this chart would change if we had removed asset limits?
Absolutely. Absolutely. The report goes deep into the information about asset limit. We'll be talking about that in a couple slides. But the asset limit is a barrier to continual enrollment in SNAP. So because we're one of 9 states with the lowest asset limit and one of only 13 states that kept the asset limit, so everyone else has either significantly increased it or gotten rid of it overall. People cannot transition safely and securely off of benefits if they are not allowed to save. And our asset limit in 2023, I think it was $2,900, don't quote me, roughly is about there. It is way too low when you think about what could happen and what that could cause. So your car engine could go out. There's the entire $2,900, and now you need assistance again. Your water heater leaks and has to be replaced, and the flooring and whatever all else can happen in just everyday life. We know generally that you have to be able to save more than that very low amount. And I think what you would see is not that necessarily that poverty changes, right? Because people aren't earning more money. What we would see a difference in is potentially an increase in SNAP enrollment and a decrease in the red line, the food insecurity and very low food insecurity. Any other questions?
Not at this time.
Okay. So this data is from the U.S. Department of Agriculture. They are who oversees overall the SNAP program. They are the ones who provide the funds. SNAP is funded through the federal government, and uh, you'll hear about the Farm Bill periodically because in theory, every 5 years it's supposed to be renewed. It was supposed to be renewed in 2023. It got an extension for 1 year in 2024. It has been extended again. It has not been renewed. This is a problem that happens quite often with Congress in terms of our legislation that needs to happen. We don't see movement, and then that means that whatever numbers were input to decide how we figure out, the programs don't go away when they do these extensions, right? The funding remains there, but it remains at that same level. There's no increases, there's no evaluation to see if something else is different. One of the things I think is really important to understand, just generally speaking, we know that Black and Hispanic families have much higher rates of food insecurity than their white counterparts. And even if you assess for all households, they still are roughly twice as high as all other households. This is not because of anything that they have done, but because of long-term systemic discrimination that has led people to be in situations in which they just do not have the funds. And we'll see over and over again that it's really hard for people to access benefits because we put a lot of barriers in place. Ty Jones Cox is the Vice President for Food Assistance at the Center on Budget and Policy Priorities. They're one of our national partners and funders. And this quote I think is really important. SNAP is and remains our most effective tool to combat hunger. Please understand this program is effective. You might have heard things about SNAP that are negative, but SNAP on the whole is effective. One, it puts dollars into the hands of people to buy groceries, right? That is the number one thing. Two, it puts money into local communities. So if you receive SNAP, even though the federal government is the one that allocates the money, they grant that money to the states, and the state is the one who administers the program. So that means that the money gets spent, if you live in Arkansas, the money that you receive for SNAP gets spent in Arkansas. And that's really important. We need to make sure that we focus on that idea as well, because for every dollar that is paid out in SNAP, it brings back to communities more than $1.70. And it's important to remember that that money goes to local communities. But we just talked a little bit about the differences between race. Black and Hispanic people are more likely to live in areas identified as food deserts. And what that means is they may not have a grocery store, so they may have to shop at a gas station combo store, or they may only have one store in their entire county that is far away. And so it can be really difficult to access and use your benefits, right? So as long as we are taking appropriate steps to use the accessibility and different features that are available to a state in how they administer the program, because the state gets to decide how they administer the program, then SNAP is really effective. And it is effective at the level that we know it puts money right directly in the hands of families to make sure that they can have access to quality foods. So let's talk a little bit about SNAP. and how we got here. SNAP was originally known as the food stamps program. Does anybody know when the food stamps program was created? Put it in the chat.
We have the 70s, 71, 74.
1939.
Oh, we had one person got it right, 1939.
Excellent, excellent. 1939, the first federal food stamp program was created. It was a pilot project, was part of FDR's New Deal. But it focused a lot around the way private programs had run before, which were generally programs that targeted widows and orphans. The orange stamps, one reason that it was difficult for people to access is because it wasn't actually intended to be a hunger alleviation program. I know it's hard to believe. We have the best hunger alleviation program there is in SNAP, but when it started as food stamps, it was intended to help the farmers who had the excess crops people could not afford to buy. So one of the issues is who got to participate in the program. You had to be able to purchase the orange stamps in order to receive the blue stamps. So you would receive the blue stamps for free, and that would allow you to purchase excess goods that they had. You couldn't purchase things like alcohol, and other things, but um, generally speaking, it was for the surplus. And the intention, while they knew it was going to help hungry people, that wasn't the main intention, right? The main intention was that we should make sure that we don't leave these farmers without a way to get their crops sold. So the first official SNAP program, over the years, the programs went and came. So they would bring it back as a pilot and send it back, and it would come back and go back, right? It would stop, it would go. And that's really difficult for people because every time a pilot project happens, things are changing. The program doesn't work the same. In as part of the reforms under President Johnson, he signed the official first food stamp program. Officially, the food stamp program was in the 1960s, and it meant that it had protections within it for the first time. You could not discriminate against people on the basis of race, religion, national origin, etc. Those protections didn't exist before because the programs were pilot projects, and each time they were introduced, they were just small programs. Um, when we look at the different programs, they each had different goals, but in the 1990s, we transitioned officially away from the idea of food stamps because food stamps has a very negative connotation. And now you can see at the bottom corner here, we have what's called EBT. EBT stands for Electronic Benefit Transfer. It's a system that allows benefits to be loaded onto the card without the person having to go into the office or do anything. And it functions essentially as a debit card, but only for items that are SNAP eligible. So if you've gone to the grocery store, you've seen little cards on the walls of the food products where it says SNAP eligible, or it'll say SNAP or WIC or something like that. So those are the items people are able to buy. Now, who is eligible for SNAP? In Arkansas, you have to be a US citizen, or a certain immigrants are allowed. We have been working for many years to help ensure that the Marshallese in our community. Arkansas has one of the largest populations of COFA migrants. So those are Compacted Free Association migrants, people who we have a treaty with and allowed to come and live in the United States legally, and also work here legally, but they were accidentally written out of the law. Laura Kellums, our Northwest Arkansas director, put out a report last year that was really amazing that works through the steps of how this happened. But essentially, in the 1990s, when we were doing welfare reform, um, Congress forgot there were people other than citizens, um, legal permanent residents, and um, undocumented people. So they really left out large swaths of people. But the important part was they left out this group of people who we have treaties with intending to improve their livelihood because we have damaged their home to the point where they can't grow things there, and they were not eligible for SNAP. So last year, our legislators led the way, especially Senator Bozeman, on ensuring that full benefits were returned to Marshallese people and other coastal migrants. And that is a big issue for Arkansas. We don't know exactly how many migrants are here from the Marshall Islands. We do know there's a big population in Northwest Arkansas, another large population in DeQueen, and another in Southeast Arkansas. Um, but a total number has never been done. And unfortunately, the census is not going to release race and ethnicity data from the 2020 census. So we had hoped that that would give us accurate data. Certainly, we have probably the largest population outside of Hawaii. For many years, we had the largest population in the United States. But this is really important. It means that we need to have access for those groups to who have never before been eligible and who are now eligible. The Marshallese in Arkansas are some of the most food insecure families in the entire state. There was a very small report that looked at pregnant women overall in at UMS, and Marshallese women were much higher than their counterparts in terms of being food insecure and not knowing where their next meals were going to come from. So, in addition, you have to live in Arkansas to get food stamps in, sorry, to get SNAP in Arkansas. Um, and you have to have an income that is at or below 130% of the poverty levels. As I said, this number gets released every year, and then different programs have different rates, and everybody has to go look and see what's going to be the new amount. For a family of three, which is the average size family on SNAP in Arkansas, for fiscal year 2025, that means the most they can make is $33,576 annually, or $2,798 a month. And after the allowed expenses are accounted for, they must make $25,824 annually, or 21,000, or sorry, excuse me, $2,152 monthly. What does that mean? How does a family of three in Arkansas live on $2,000, essentially $2,152 a month? All of the major expenses are not being counted because we have not updated how the poverty guidelines are established. When we think about this and think about how many people have been helped by receiving SNAP in Arkansas, uh, one more thing, I'm sorry, before I jump to that. So we talked already about the asset limit a little bit. You cannot have more than $3,000 in resources or $4,500 if you have a disabled or elderly person in the family. That is the amount for the whole family. It's the amount for everyone in the family total. And it's the same size. It's the same amount regardless of house size. So income limit is one, and then the asset limit is a different thing. Are we clear on that? So the assets is not just money you have in the bank. If you have a if you have one person working, but you have two cars, that second car could be counted against you as an asset. And easily put you well over that $3,000 or even the 4,500, because it's based on, again, information that's outdated. Any questions, Rebecca, on that?
Nope, don't see any.
Okay. And then last, there's work requirements that are on this program. We know these don't work. We've seen it time and time again through the Medicaid program. It doesn't really provide what they want it to provide. But generally speaking, anybody who's 16 and over has to meet work registration, which means that you fill out the paperwork, unless you made an exemption. And then work requirements essentially means you need to be working at least 20 hours a week. These were extended through the budget deal between President Biden and the Republicans in 2023. And that increased the age limit to 59. So it was previously 55, now it's 59. Several states have been moving towards higher limits even. And I think the question there is like, when is it going to be enough, right? Like, when are you going to be allowed to retire instead of working forever? So, well, okay. So we can see overall 420,813 people were helped by receiving SNAP in 2023. This includes the number, it does not include any adjustments that were due to cancellation. So if somebody had benefits and lost them during the year, that number has not been taken out. So this is unduplicated people, but it's a little bit higher than it maybe should be based on those cancellations. We don't know how many cancellations there were, but this is a large number of people that we're talking about. It's a very large program. So even though that's a large number, recall that our poverty rate and our food insecurity rate is much higher. So why isn't this number increasing? Why is it decreasing every year? There's a lot of reasons, and most of them start with the structural and additional barriers that we put in place in Arkansas that other states choose not to. We make it harder, not easier, for families to access SNAP. We also make it easier for people to lose benefits because of what we call a benefit cliff. So what does that mean? One, our application is 30 pages long. That's actually one page less than it was the year before. So in 2024, it went to 30 pages. It was 31 pages in 2023. And most states are half that. We also included things like checks with the Racing Commission and the Lottery Commission, because we assume people are going to like essentially try to get SNAP benefits and go through this whole process, which is so complicated, and the forms and everything else, if they've won the lottery. I honestly cannot imagine. And then because of the asset limit and because we choose not to expand access through things like categorical eligibility, what happens is people can lose their benefits because they make slightly too much money. So if you get a bonus at work, that amount, that one-time amount, could push you over your annual amount that you're allowed to make. If you get a raise, some people can't take um, opportunities for advancement at work because the increased amount that they're going to get is not equal to how much they receive in SNAP. And that's a problem, generally speaking, with all of the companies that are hiring people and how they're paying people. But it is a real problem because many companies count on SNAP to make up the difference between what they're paying their employees and the benefits that are available. And it's not on the families. It's really on these companies who are not paying their part. And if you have more than $3,000 at any point during the year, you, again, because of the asset limit, will become ineligible. And many families, once they fall off, they don't get back on because it's so difficult. I think it's important to understand that, you could get over $3,000 and then the next month have to spend that whole amount of money. $3,000 is not enough. It's just simply not enough. But it's enough to make you lose your benefits. And then again, a lot of people on SNAP are working families. And because of that, they don't have the time to go back and sit through interviews and do the entire process all over again. So, because of these barriers, long applications, complicated forms, things are not properly translated for the Marshallese, for example, even though we know we now have all these people who are eligible to apply, these things make it much harder. And the benefit cliff is not necessary. Many states, almost all, have taken advantage of the flexibility of categorical eligibility. So basically, what that means is if you are eligible for Social Security disability, you would automatically be eligible. If you were eligible for Medicaid, you would automatically be eligible. Things like the cross registration, and we don't have that ability yet in Arkansas.
We have a question. We have about 15 minutes left. So if you have a question, please put it in the chat or the Q&A. The question is, how do the SNAP work reporting requirements differ from the recent Medicaid ones that allow for exemptions if you volunteer, take care of your family, go to school, etc.?
So there are exceptions for people who are enrolled in school. I am not sure about whether or not the expansion allows for volunteering. Because so these work requirements were an agreement at the federal government level. So it expanded what people had to do already. Um, I don't believe volunteering is one of the things you can do, but I will check on that. And if I get an answer, I'll have Rebecca send that out with the report and the recording.
Okay, I have another question. I work with children in foster care. Does a child being in foster care automatically qualify a foster family for SNAP?
No. You would think it would, right? You would think it would. It does not. It should. It should. However, they're going to look at your income and decide whether or not you can afford. You're going to have to meet all the requirements just like anyone else. Um, Now, sometimes it can be a condition of the foster care, depending on the situation, but it is, I did interviews with people who were on SNAP and lost their benefits. And I spoke with a woman who had to take in her sister's children, two of them, one of whom was disabled. Both of them, I think, were under age 6. And, this was like essentially she doubled the size of her family and she's a single parent. So she believed that she was going to get these benefits for them. And they said, no, absolutely not. And even though she's taking them in so that the state is not having that burden, which is a much higher cost, right? So no, it doesn't automatically qualify you. It automatically qualifies the child sometimes, but it depends on the situation.
It's all right now.
Okay. So how do these policy decisions impact equitable access? We've talked about the asset limit. We have this one of 9 states with the strictest asset limit cap of all the states. Again, we choose that. We do not have to have that. Also, in 2021, in June, the governor declined the expanded benefits. This is right at the time that prices were soaring at the grocery store. It was part of the push to try to say people needed to go back to work, but this was a bad decision for families. This hurt families because others were able to continue receiving the expanded benefits, which came fully from the federal government until the end of the pandemic was declared, and so they had it for a year longer, essentially. And that means that our families went way back below the poverty line when those benefits were taken away. And they had a much higher cost at the grocery store. And let me just add, June is never a good time to take away benefits, whether it's SNAP or any other type of food assistance that we have. It is never a good time because that is when kids have less access to food because they're not in school. And summer loss learning is a real thing that happens because of summer hunger. And the increase of that is exponential. So, and again, the last thing, refusing one of 6 states that doesn't take advantage of the categorical eligibility flexibility that we have. So I've talked a little bit about what the cutoff is, right? For a family of 3, you got to have the actual budget that you're allowed to have is $2,495. Again, this measure is seriously outdated. And if you look at families who are considered to be ALICE, so ALICE is um, asset limited, income constrained, and employed. What it means is they make over the amount, they're ineligible for benefits, but the reality is the actual cost of living is inaccessible for them. So a household survival budget is the amount that you need just to live in Arkansas. And you can see how much higher it is in total. It's almost doubled um, when you get to the top there. And the fact is that our eligibility cutoff does not take into account the actual costs of what it costs to live in Arkansas.
We have a couple questions. One, I'm going to wait to get to the policy recommendations for it because it's connected to that.
Sure.
But there was a follow-up question about children in the foster care system qualifying.
Mhm.
You said that the child themselves might qualify, and there's a question, how does that child qualify in that case?
Generally speaking, a child will qualify if they are in like a group home situation, as opposed to being, so like if they are in a foster home, then generally speaking, it's gonna be the income of the family unless there is some arrangement made in the process of the foster care. For example, if the child is disabled, they may qualify for SNAP on that basis. And so like it's not because they're in foster care with a family, it's because of the disability. Um, and so it's pretty complicated when you look at it, but generally speaking, you don't just qualify by being in foster care. It's one of the things that categorical eligibility would fix is that, yes, if the child is in foster care, we think it should in fact automatically qualify you because again, we're asking families to take on a burden that would be for the state.
Um, and that, well, it leads to another question, but before that question, Our policy director, Kristen Harper,
Oh, yeah.
wanted to add individuals who are in foster care when they reach 18 years of age are eligible from the age of 18 to 24 and don't have to meet the other requirements. So that's another way. And then someone asked, can you share again what categorical eligibility is?
Yes. Thank you for that, Kristen. I had that conversation in the Northwest. Um, and it's so important for the foster kids that are transitioning out to have access to SNAP. So that was really important. Categorical eligibility means that if you meet the requirements for another program, such as Social Security disability, such as Medicaid, um, that you would use that to automatically qualify for SNAP. So um, you wouldn't have to keep applying with the different agencies, because if you already received one thing, you should already qualify for the others. And what it essentially does is eliminates that cliff that we talked about. So the last slide said, is it impossible in Arkansas? I know in the beginning I started with that there's so much uh, history of food insecurity and poverty. And that is true, but it's absolutely not, because in 2023, all of these things happened. Um, we signed up for summer EBT. So in 2024, kids were eligible to receive $120 to combat summer hunger. Um, we passed Act 201, which protected combat veterans' benefits by removing them from the income limitations. This should really be expanded to include disability benefits in general, not just for veterans, but for all disabled folks, because your disability income does count for income against SNAP. And then, we passed Act 656, which made 49,000 students eligible for free school lunch who previously had to pay the reduced price.
Okay.
And
And Kristen also wanted to point out that kids in the foster care system automatically qualify for the summer EBT program.
Yes, that's correct. Kids who are in foster care, kids who are on Medicaid. So we allow categorical eligibility in some of the programs, but not in others. So even though it's an EBT program, meaning it's an electronic benefit transfer, it is separate from SNAP. It was essentially created during the pandemic, and was found to be so successful that the federal government kept it and expanded it and made it a program permanently. And so now every year we have to make sure we sign up and ensure that we are addressing summer hunger, not just through summer EBT, but making sure that we have sites that are available for kids, making sure that there are summer programs where there's food, especially in places like the Delta, where there's long drives to get to the grocery store, and can be really difficult for people to access. Um, uh, high quality foods.
And
So,
we have 5 minutes left, but I want you to know as you end this, please end it with a response to this question. If we
okay,
implement all of these changes, how much would it cost the state and federal government?
if we implemented all of these changes, how much would it cost the state and federal government? I can't tell you what that would be, because it depends on if, I think the cost is less than the cost we're paying long-term for the medical um, treatment for these children who are growing up right now and have been for the past 10, 20 years, with adult now diabetes, that they got because they were food insecure as a child. Remember that it leaves you with long-term conditions. It does not go away. It is going to end up costing Medicaid much more to treat those conditions than it will cost for us to provide income, uh, provide SNAP, sorry, um, to the families who are eligible for it. When we look at categorical eligibility, that group of people should just be eligible. What we're saying there is not that, it's like a whole new group of people who are eligible. Arkansas has one of the lowest participation rates in the United States. Only roughly 67% of the eligible people have SNAP. Why? Because of those barriers we talked about, and because we're not making it accessible. If we make it accessible, then we get to 100%. We reduce the healthcare costs on the state, which are extremely high right now. We make sure to increase access for pregnant women, for example, who also in the state face serious consequences if they lack nutrition and dietary um, uh, requirements especially during the early part of pregnancy. So, making sure that we comply and with these policy recommendations overall is going to cost us less. And once kids are receiving access and are healthier, on the opposite side, that Medicaid cost goes down. I think it's important to remember that it's not about just this is not just a cost benefit scenario. We are talking about 100,000 people who are eligible but are not receiving it and who are going hungry. And that should be an anathema to anyone who lives in Arkansas. So our policy recommendations, we need to repeal the asset limit for SNAP. Repealing the asset limit would allow us to say to people who, generally financial advice is save for 6 months at least, right? $2,000, $3,000, not enough. Repeal the requirement to participate with child support enforcement. This is overly burdensome, especially on single mothers. Single parents in general do not have the same access to court as married families did. In order to get your agreement on child support, you had to go to court if you were married and you had children together. If you were not married, you don't go to court. And then instead, we're asking people to burden what are potentially good relationships with the co-parent who is supporting the child by putting them under child support enforcement provisions. Raising the income limit to 200% of the federal poverty guidelines, even that is still extremely low, but it would make sure at least that those Alice families that are on the brink of one single disaster would fall into, would be able to access benefits. Again, allow broad-based categorical eligibility. There's just no reason to make people keep applying at different places unless that the intention is to make it harder and make it so that, you get denied here and maybe you'll eventually give up and you just don't have enough food to eat. Reduce the length of SNAP application. Really, it should only have the things that are absolutely necessary. Add funds into the program to ensure benefit adequacy. This is really important. When we look at the cost increase of food over time versus the increase in benefits over time, there's no alignment there. From 2020, grocery costs have gone up more than 15% in Arkansas. And so when you look at that, it's important to really ensure that benefits in Arkansas are at the level we want people to be able to access healthy foods, but they can't do that if the benefits are only 70% of what they need to buy groceries for the month. Simplify the application process. It should not be complicated to apply. Many states have made it so that you can text your application, you can go online, and Arkansas cannot move fully to an online type of system because we don't have that connectivity in terms of Wi-Fi or even cable. We also don't have a good cell phone service in many parts of the state. So making sure that there are multiple ways to apply, but that they are all simple. And then, this is outside of SNAP, but adopt universal school meals. These programs are meant to work together. so that each one of them is a component of helping ensure the health of our communities. And universal school meals, there's a bill currently in the legislature to adopt universal school breakfast that we know the governor supports this initiative. And it's super important that our kids have access to food during the school day to make sure that they're able to learn. So those are our recommendations. Please read the report and look at the data. There's also information in the report about county by county, how many people are at poverty, how many people receive SNAP, and other information. So please do download it and look at it. Any other questions, Rebecca?
Yes, I know some people will have to hop off, but we can see if we can answer this question. It was
Uh-oh.
a follow-up one to the funding. The question was, but how much or what percentage for Arkansas versus the federal government in terms of funding it?
How much for the federal government? How much does the federal government pay versus how much does Arkansas pay?
I think so.
Um, off the top of my head, I do not know that number. I'm sorry. It has escaped my brain. Um, I'm not sure. I'll have Rebecca send that out with the other data. But the federal government pays the largest percentage of that. Um, and all of these things that we suggest, for example, categorical eligibility, many other states have gone ahead and done that. It's you submit a request through the Department of Agriculture, Food and Nutrition Service, and they will waive the requirement and they will allow it. It is not something that is hard or strange or difficult to get. And in fact, if we were allowing people to, go through one process, it would make it much easier for everyone, reduce costs overall administratively, and we pay a lot of the administrative costs in terms of the state. That falls on us.
Well, thank you everyone so much. Like I said, the recording, slides, and report, as well as additional follow-up materials will be sent via email in the next few days. We appreciate all for joining us and take care.
Thank you.